Colon cancer. It's no longer a disease that just affects people over 50. More and more younger adults, even in their 20s and 30s, are being diagnosed. The scary part? Early symptoms are so easy to miss until it's too late. Today, we'll break down why these numbers are climbing, what's really behind this trend, and most importantly, the symptoms you should never ignore. Stay with me until the end, because I'll give you a clear checklist of warning signs and practical steps you can start today to protect yourself. Colon cancer. It's not exactly a subject people bring up over coffee, but maybe it should be. This disease is no longer something that happens mostly to older adults. In fact, cases are climbing fast in people under 50. That includes people in their 30s, even their 20s. And the most frightening part? The early symptoms are often so quiet, they slip right past until the disease has already progressed. That's why we need to talk about it, not in a way that scares you, but in a way that gives you the power to notice problems early and take action before it's too late. Colon cancer ranks as the third most commonly diagnosed cancer and the second leading cause of cancer deaths. Those numbers alone should make us pay attention. But there's another challenge: the noise around the disease. The internet is full of health claims, miracle cures, and contradictory advice. Even doctors can feel overwhelmed trying to sort fact from fiction. And behind it all, there's a huge industry built on treatment rather than prevention. The best way to cut through that noise is to understand exactly what raises your risk and how you can protect yourself. One of the most common myths I hear is that colon cancer is mostly genetic. The truth? Family history plays a role, but it's only responsible for about 5 to 10% of cases. The other 90% come down to factors you can influence. I like to tell patients, genes load the gun, but lifestyle pulls the trigger. That means the food you eat, the way you move, the stress you carry, whether you smoke, whether you drink. All of these shape your risk far more than most people realize. The best part is, that also means you can change them. Modern research keeps showing how powerfully our choices affect our health. Diets rich in vegetables, fruits, healthy fats, and spices like turmeric can lower inflammation and help protect the lining of the gut. On the other hand, a steady diet of ultra-processed foods, sugary drinks, and processed meats creates an environment where inflammation thrives. Chronic inflammation is like a slow-burning fire inside your body. You might not feel it, but it changes the way your cells behave, making it easier for abnormal ones to grow. And when you add physical inactivity, poor sleep, and constant stress into the mix, the fire burns hotter. Most colon cancers begin quietly. They often start as small growths called polyps that form on the inner wall of the colon. At first, they're harmless, they don't hurt, they don't block anything. You wouldn't even know they're there. But over time, in the wrong conditions, some of these polyps can start to change. The cells inside them grow in a disorganized way, and if nothing stops them, they can become cancer. Because they cause no symptoms at first, they can go undetected for years. That's why screening is so important. It's the only way to catch them before they turn dangerous. For most people, doctors recommend starting colonoscopy screenings at 45. If you have a parent, sibling, or child who has had colon cancer, you may need to start earlier. A colonoscopy allows the doctor to see your entire colon, find any polyps, and remove them before they cause trouble. Think of it like checking your garden for weeds. You can pull them out before they spread. It's not the most fun afternoon you'll ever have, but it's a whole lot better than finding out too late. Where a tumor grows in the colon makes a big difference. On the right side, stool is still liquid, so blockages rarely happen until the cancer is advanced. This means early symptoms can be subtle. There might be slow, hidden bleeding that leads to iron deficiency anemia, making you feel tired or look pale. On the left side, stool is already solid. A tumor there can block the passage much sooner, causing constipation, changes in stool shape, or even alternating diarrhea and constipation. Sometimes advanced tumors on the left side create what radiologists call a bitten apple image on scans, where the tumor has narrowed the intestinal passage. One of the earliest warning signs is bleeding, but not all bleeding is visible. Sometimes it's hidden in the stool and can only be found with a lab test. Over time, hidden bleeding can cause iron deficiency anemia. If you're over 45, feel more tired than usual, look paler, or your doctor says your iron is low without an obvious reason, it's worth asking for further checks. Another red flag is any sudden, lasting change in your bowel habits. If you normally go every day and suddenly go a week without, that's a sign. If your stool becomes consistently narrow, like a ribbon, that's another. Your body whispers before it shouts, The trick is to listen early. As colon cancer grows, its symptoms become harder to ignore. You might see bright red blood when you use the bathroom. You might have cramping or bloating that doesn't go away. You could lose weight without trying. Fatigue may become constant. If the cancer spreads, it can cause pain in the liver, shortness of breath if it reaches the lungs, or bone pain if it spreads to the skeleton. By this stage, treatment is more complex, which is why catching it early makes such a huge difference. Polyps are the starting point for most colon cancers. They're small growths that stick out from the lining of the colon. Most are harmless, but a small percentage can turn into cancer over time. The beauty of a colonoscopy is that it doesn't just find these polyps, it removes them immediately. Imagine spotting a tiny weed in your garden and pulling it out before it has the chance to drop seeds everywhere. That's exactly what removing a polyp does for your colon. For a long time, people believed their DNA was an unchangeable script. We now know it's more like a set of light switches. Healthy habits can dim the activity of harmful genes, while poor habits can crank them up. That means the food you choose at the supermarket, how you cook it, how active you are, even how you manage stress. All of it influences the risk of a polyp turning into cancer. Every choice is a nudge in one direction or the other. Several everyday habits can push polyps toward becoming cancer. Eating a lot of ultra-processed foods is one of the biggest offenders because they often combine harmful fats, high sodium, and added sugars all in one. Diets heavy in red and processed meats, things like bacon, sausages, and salami, also add to the risk. Using too much of certain vegetable oils except for healthier options like olive oil isn't helpful either. Then there's sugar and excess salt, both of which can damage gut health over time. Chronic constipation slows down the movement of waste, giving harmful substances more time to irritate the colon wall. An unhealthy gut microbiome with too few good bacteria can also make things worse. And of course, smoking and heavy drinking damage cells directly. All of these are like pouring fuel on a slow-burning fire. The less fuel you give it, the less chance it has to spread. On the other hand, plenty of daily habits can protect your colon. Eating a variety of colorful fruits and vegetables every day provides a mix of antioxidants that help cells repair themselves. Adding spices like turmeric can help fight inflammation at a microscopic level. Healthy fats like omega-3s from salmon, tuna, sardines, chia seeds, flax seeds, sesame, avocados, and free-range eggs all support gut health. Drinking enough water and eating enough fiber keep digestion moving, which lowers the time waste spends in contact with the colon wall. Even sleep, regular exercise, and strong social connections can reduce inflammation and strengthen the immune system. For years, people with diverticulitis were told to avoid seeds and nuts. But research involving tens of thousands of patients has shown no link between these foods and diverticulitis complications. In fact, they can improve gut health and may even help protect against colon cancer. That said, everyone is different. If you have specific gut issues, it's always best to talk to your doctor about what's right for you. A colonoscopy is a straightforward medical procedure. A thin, flexible tube with a camera is guided through the colon so the doctor can look for any abnormalities. If a polyp is found, it's removed on the spot and sent to a lab. The whole process is done under sedation or mild anesthesia, so you won't feel pain or remember much afterward. For most people, one colonoscopy every 10 years starting at 45 is enough, but if you have higher risk, you might need them sooner or more often. If you want to lower your risk starting now, focus on your everyday choices. Fill half your plate with vegetables and fruits at both lunch and dinner. Cut back on processed meats and swap them for beans, lentils, or grilled fish. Drink water throughout the day so your digestion keeps moving. Move your body. Even a brisk half-hour walk helps. Make space for rest because stress affects your gut more than you might think. And keep your checkups on the calendar, especially your screenings. They're not glamorous, but they're one of the most powerful tools you have. Colon cancer is a serious threat, but it's one we can outsmart. It grows slowly, which means we have time to act as long as we don't ignore the signs. Awareness is your first defense. Healthy habits are your second. Screening is your third. Every healthy meal, every walk, every glass of water, they all add up. Don't wait for symptoms to shout. Listen to the whispers and share what you've learned today, because the knowledge you pass on could save someone's life, maybe even your own.